As a cardiologist, most of my patients are on anywhere from 3 to 5 medications a day. And they're really non-compliant. A lot of them are non-compliant because of so many medications they have to take, typically throughout the day. So when you can give them one pill that encompasses all their medications, they're much more compliant with their medications. You know, I could typically give them their statin, their hypertensive medication, their diuretic, their beta blocker, so they can take that one medication, eliminate all the other times they have to take their medications once a day. I found that over time, that from a medical perspective, they were really responding very nice to it. I thought that maybe their blood pressure would become too low by giving all these medications at one time, where they would have a lot of side effects, but it really wasn't the case. That when I found that by giving them all the pills at one time, they really did very nice. I had very little side effects, and they did extremely well on the medication. The patients, as far as convenience and satisfaction, they couldn't be happier. I get so many compliments that, you know, where has this Polypill been and why haven't I offered it to them from before, that they are just ecstatic the fact that they can take one pill to give them all their medications. They don't even know how to thank me for this medication. The prescribing process for Polypill is very, very convenient. Number one is I carry the prescription pad right in my pocket. I have a list of the most common medications that we use for Polypill. I simply circle the medication I want. I indicate and circle whether it's AM or PM. I circle the dose. There's a write-in area. So for any of the medications that are not on the most common medications, I would just write those in, write my SIG, my license number, sign it, and on the top of the medication, on the top of the prescription, I would give the patient's name, telephone number, and their address. It's fax in, and that's all you got to do. Polypill is not in the future in my practice. Polypill is now in my practice. I use a lot of Polypill prescriptions at this point right now. As I said, that patients love it, the convenience, the satisfaction, and the fact that these patients are taking their medications on a regular basis without missing medications, better blood pressure control, better lipid management. My best testimonial for Polypill is that I take Polypill myself. I know what it's like to open those pill bottles every day and to take 3 different medications at one time. And I take a Polypill at night, and I will tell you, it is the most convenient thing to do. So if I do it myself, I'm certainly going to recommend it for my patients.